So very interestingly, recently I met with the current Minister of Health, Datuk Sri Zulkifli, and he was talking to me about moving the Ministry of Health from sick care to healthcare. That's a huge pivot, right? Very, very important is obviously knowing what are the sicknesses, what do people need, where do they need this, and then you look at healthcare, which is the preventative part of it, so that you've got a large population here in Malaysia, 34 million, and obviously already the hospitals are close to maximum, if not already past it, right? So we're looking at how do we manage that. And part of that management is looking at the people who are well and healthy and trying to ensure that they stay in that healthy position as long as they can. Now, that's the health care part of it, right? So how do we see digital healthcare moving to assist this?
Excellent question. Very good preamble. If you look at this part of how digital health would help out or assist preventive healthcare, it is basically going to be or is the backbone of preventive care.
Okay.
Number one, when you
Right.
talk about digital health, you talk about data.
Yes.
How do we now primordially prevent someone from getting ill?
Okay.
Primarily preventing them from getting ill, right?
Right.
So when you talk about preventive healthcare,
Right.
as in the public health fraternity, we talk about the various different levels of prevention.
Sure.
The often known one is primary
Right.
prevention, but now we are moving towards primordial prevention.
Okay.
Identifying risk factors in much more advanced.
Okay.
Right? Identifying all those important individuals who are at risk of potentially being sick in
Sure.
the next few years.
Absolutely.
How do we now institute analytics like predictive,
Right.
then eventually prescriptive analytics? So it's basically looking at health information data, various different other data sets, combining everything together and identifying this, and eventually reaching to what we all want, precision public health.
Okay.
Right? How will the government, how will Ministry of Health identify and precisely intervene on certain cohorts of the population who really needs intervention to prevent them from getting sick eventually. Right? So, like what I said, digital health as the backbone, using various different data sets to identify this particular population.
Okay.
And once we have identified, we can use digital tools to intervene.
Right.
You know, like for example, I would like to give you this example of, knowing Mahesh, probably now overweight,
Right.
having various different family history of diabetes.
I didn't say that. You said
Right?
Okay.
You know, having history of diabetes, family history of diabetes and whatnot. So Mahesh is sort of like categorized into the possible individual with risk factors.
Okay.
So now how our public health experts can tailor care plans
I
to
see. Right.
intervene,
Right.
to institute any sort of preventive mechanisms to nudge him to, make sure that he doesn't move into the next bucket, which is being pre-diseased and eventually diseased.
I see. So just keeping you as healthy as possible and digital tools.
Yes,
for
using digital tools. I think that's very important.
this. Okay.